I'm sitting here with Dr. Marshall Hagins, who is a professor emeritus from Long Island University in Brooklyn, New York. He has published over 40 studies in a variety of pathologies, including several studies on yoga, some of which I've done along with him. He has a PhD in biomechanics. He is a practicing physical therapist and also was a professor of physical therapy for a very long time. So a few years ago, you did a study on pre-hypertensive conditions in African Americans. Were a lot of the people coming into that study, did you notice they were in high stress conditions, or?
You know, this study wasn't designed for that. There is evidence out there, many studies which have shown that one of the theories is that part of the reasons that African Americans have higher rates of hypertension is because of essentially racial bias in our society, that they constantly have to negotiate things that people in more white people essentially often don't have to in terms of biases, and that increases stress.
I mean, we know that stress is a driver of cardiovascular disease.
Yes.
Can you tell me a little bit about that study?
Yeah, the study essentially, we had, it was an NIH-funded study. We had ultimately about 60 people divided randomly into two groups. One, we had a physical activity group, and then we had a yoga group, which you designed the program. It was mindfulness, meditation, and physical yoga. And at the end of the day, and this is what most yoga studies have shown that have looked at hypertension, we showed that yoga gave about a 5-degree drop reduction in diastolic blood pressure over and beyond the physical activity group. So it showed a significant decrease due to yoga. And this was using a 24, you probably remember, these people wore a 24-hour monitor for their blood pressure. This was a 24-hour issue, so this is a gold standard way of measuring blood pressure.
In regards to the decrease in blood pressure, like clinically, what does this basically mean?
When you have a decrease of even 4 or 5 points of blood pressure, it doesn't sound like much, but it changes the rates of cardiac disease that people have as a result of that. And these kinds of levels of change are equivalent to the changes you'll see in physical activity programs or diet programs, which are unrelated to yoga. So it's a significant change. It's meaningful. It's clinically meaningful.
So you have basically what is essentially a mind-body practice, which is yoga, mindfulness, meditation, breathing practices. These are mind-body practices that are affecting a change on a physiological system that have somehow become out of balance and are, I don't know the correct word for it, but they're showing a disease, cardiovascular disease.
Right. You can alter you can alter, if you're saying the measurement of the disease process is high blood pressure, and you lower that, you are essentially changing the disease process. Mm-hmm. Whether you're getting at the underlying cause of the disease process is a whole other question. Mm-hmm. And how yoga precisely achieves that, whether it's simply relaxing the arteries, the study didn't do that, whether it's changing cortisol levels, whether it's the mechanisms we didn't study, and it's complicated and would take a good bit to really get to that. And there's a lot of work being done now in that in yoga.
So I think that's a really interesting point, is that we might be using these mind-body practices to affect the presentation of symptoms or improve lifestyle, improve overall general health, but we don't know necessarily if it's going to affect or change the underlying mechanism.
Yeah, I mean, there's
whatever the thing is that caused the problem might not necessarily go away, but you can manage what's happening.
Right. I would say in some cases, if, for example, stress is the underlying problem, I suspect that yoga actually alters the underlying problem. Mm-hmm. If it's something else that's creating the hypertension or whatever the pathology is, it may not. But yeah, there's a how, and there's how is yoga working and does yoga work? These are the two big ideas. But that dichotomy in science and looking at all kinds of interventions is problematic. It's much easier sometimes to show that something does work than try to figure out how it works precisely. For example, aspirin. We knew for thousands of years people were drinking willow bark juice knowing that it decreased headaches and didn't know why. It was only in the last 40 years that scientists figured out what the chemical composition of that was and how it affects the body. So even in things that are very mainstream now, even exercise itself, which is well accepted to address a whole host of problems, the actual mechanisms of how exercise does its magic are not that well explained. So not knowing precisely how yoga works is frustrating, but it's not abnormal in many interventions.
Right, and it's not a problem. And seeing the correlate that, okay, we know we have, these are some of our different physiological systems. These are some of the different things that could go wrong with them. That's largely what this module is about, these different pathologies. And here are some things you can do to address, to make yourself feel better if one of these systems starts going a little bit wrong.
Right.
And so it seems like particularly stress is one of the things which affects a whole range of physiological systems.
Yeah, absolutely. And I think when you look at the literature of yoga and the people who are trying to figure out exactly how yoga works, fundamentally they're aiming at the stress system and saying that if yoga can alter from both a bottom-up and a top-down approach to stress
And could you explain what those two things are?
For a bottom-up approach would be, the things that we do physically, the physical postures and the breathing, those kind of things influence, like in a reverse engineering.
From the brainstem up through.
From the body up to the brainstem, as opposed to the other way, which mindfulness and cognitive sort of approaches may be influencing from the top down. And inside the brain, you're getting, because it is a mind-body approach, and we are mind-body creatures, this is fundamentally the way to do it, from a bottom-up and a top-down approach. You're really getting the best of both worlds. And the beautiful thing about yoga is that its approach is all of those pieces. All of those pieces are part of it. And that's, I think, ultimately when we get down to mechanisms, and it may take 20 years or 100 years, I think what we'll see is because all of those things fit together, that's really the magic of yoga, I suspect.
Could you speak a little bit about your opinions on general exercise, fitness, yoga, and what could be appropriate for different kinds of people? Like, how do you know if you need to be doing less? How do you know if you need to be doing more? How do you know if you should be doing some cardiovascular? How do you know if you should be doing some yoga? There's so many things to choose from in the fitness world. Number one, how do you know what you should be doing? And number two, like, why is yoga a good answer for a lot of different things?
I'm a mainstream kind of guy. The answer is you should be moving, and there are very clear answers on how much you should be moving, and that's in the popular press. And you need aerobics, and you probably need a little strength training, and you probably need a little stretching. And the only one of those that yoga may not do in a consistent way is the aerobic, right? Unless you're doing something extremely vigorous for a good little period of time, and most yoga doesn't quite achieve that. However, what yoga is really wonderful at is building strength and flexibility. If you just want to build pure muscle mass, you go and lift weights in the gym. If you just want to do aerobics, you go running or something. But the wonderful thing about yoga is that you're getting a package of strength and flexibility while you're increasing conscious awareness. So it's a body awareness issue. And you're putting on top of that breathing controls. You're getting a lot of things that you're not getting in the gym if you're not being aware of those pieces. And again, this goes back to the mechanism piece, where I think that these things act in some unified way to give you outcomes that other isolated exercises don't. To get to your question of what you need, everybody needs aerobics, I think a little strength building, a little flexibility. People, when someone comes to me, I kind of divide them up. Some people come in and I'm like, you're sort of tight. Your muscles don't. So yoga would be particularly good for you. It addresses flexibility. Other people come in and they're sort of loose-limbed and loose-jointed. Yes, yoga is good for you, but you may need to be especially conscious to not go into your in ranges, particularly in the beginning when you start to learn yoga. So ultimately, each person needs to have some sort of sense of what their body needs and where their head is at that moment when they go in to start to achieve fitness, and what they're going for. I don't know if that answers your question, but yeah.
Yep, I have two more questions. One, you said that yoga isn't going to give you the aerobic benefits that aerobic exercise does. And aerobics is largely going to be affecting endurance and cardiovascular health. And we already spoke about there are a variety of ways you can define cardiovascular health. One way is to reduce stress levels.
Yes.
And you already spoke about your study, which showed that mind-body practices such as yoga and mindfulness are reducing blood pressure. So there's more than one way to look at cardiovascular health?
Yeah, cardiovascular health is actually a very big brush. And certainly, if you're doing yoga, you're improving cardiovascular health if your metric is things like blood pressure and stress. If your metric is something more like mitochondria and vascularity, growth in muscle tissue, and endurance of muscle, probably not. So, cardiovascular health is a large brush.
Okay, I'll just ask one more question. What do you do for your daily practices? What's your regimen for staying fit? I mean, you're very fit, obviously. You were a dancer for a long time.
Oh, really?
But you're still super fit, and what do you know?
I do yoga.
About 45?
I do meditate, and I do yoga every morning for about an hour and a half, depending. And then 3 times a week, I do my aerobics at the gym, and I lift a little weights.
What kind of aerobics?
I do Stairmaster. Yeah. And a little bit of weightlifting. Particularly, you're probably aware, you're not, I don't think, quite as old as me by about maybe 10 years, but as you get to 55, 60, you lose muscle mass. If you're not lifting weights, you're getting weaker. It's just the way it works as you get older. So if you want to, and you can, the beautiful thing about aging in terms of muscle mass is you don't have to lose muscle mass. You can, several studies have shown, many studies have shown that you can keep strength up, but you have to use it or lose it.
All right, I think I should start lifting weights.
Not you.
Yeah.
Not you.
Kettlebells.
I've seen what you do in yoga. You're doing a lot of strength building.
Based on what you see from patients who come to see you, what's your opinion on the effects of chronic stress?
When patients come to me and they're under chronic stress, you can pretty much perceive it. I think most people can perceive it. They're either anxious or turned within. They have a story in which their affect, they're telling a story frequently with frustration or sadness. From a physiological standpoint, they lack energy. They often have sleep problems. They're having a very hard time getting out and being active in the world, engaging with other people, being active in terms of movement and exercise. And this withdrawal from the world and withdrawal from activity has huge consequences on the vitality of their system. They typically lack vitality in the health of their system. So you see the effects of chronic stress. It can be things from the condition of the skin to loss of hair, to gaining weight. It's expressed in a lot of different ways. But if you see patients for a living, or and you see a lot of people come through the door, they tend to have a sort of typical sort of appearance that you can recognize. That combined with their story. Yeah.
And what would your recommendations be for people who are intimidated to go to a yoga class for any variety of reasons? They feel like they're too stiff or too out of shape, or they don't like being in places where there are a lot of people exercising. What can they do at home that could be helpful for them in a very simple way?
Well, the hardest thing is deciding to start and actually do something. And so, there's so many wonderful videos online of yoga, and there's so much information available online. If you want to do it in the privacy of your home, there's nothing wrong with that. Or if you have the money to actually perhaps hire a yoga teacher to come to a private space with you in the beginning, it would actually be optimal, even if you only did that once or twice, if you could spring for it. But at home, the ability to do breathing exercises, and to do meditation. This does not take apparatus. It doesn't take special places. Ideally, you would have a quiet place that you could be, feel safe in. I think that's the biggest thing. You have to have a place you feel safe in. Safe and physically safe, and safe from viewing, if that's important to you, and you begin the practices. And you can have a great deal of benefit from that. I think physical postures you can also get off the internet, but I do think that having someone, the truth is, having someone guide you is better in all of these things, whether it's meditation, breathing, physical postures. But if you just want to start, you can do it by yourself.